Hello, welcome to the second week of A&P, and we're going to be studying tissues. And tissues in anatomy are a group of cells that perform a common or related function in a structure. The study of tissues is called histology. And as you can see at the bottom there are four basic types of epithelial tissue. Four types of tissues, epithelial being one of them, connective tissue, muscle, and nervous tissue. This week we're going to cover epithelial tissue and connective tissue. So this picture here kind of shows you where you would find them in the body, and I'm going to start with epithelial tissues. These tissues are going to form boundaries between different environments. So from your body and the outside world, they're going to protect, secrete, absorb, and filter. You'll see specifically that each one of these type of tissues has a function depending on where they are in the body. Connective tissue is exactly what it sounds like. It connects, supports, protects, binds other tissues together. And there's three main categories. They are going to be bones and tendons and fat and any of the soft tissues that are going to be connected to the bones and the tendons. There's three types of muscle tissues. They are going to be muscles that are attached to bones. They are called skeletal muscles. The muscles of your heart are so important, they have their own name, and it's called cardiac muscle. And the muscles that make up the walls of hollow organs are called smooth muscles. The last thing that we'll cover in the end of the semester is going to be the nervous tissue, and they are going to be responsible for internal communication, and they involve the peripheral nerves, which will send a signal to either the brain or the spinal cord, and that makes up all of the nervous tissue things that we'll talk about later in the semester. So we're going to start with epithelial tissue, and all of these tissues, if you were going to be looking at the microscope, would be fixed either with a solvent, and they'll be cut and sectioned into very, very thin slices. You are going to look at them with a light microscope that uses colored dyes, and the variations in colors are how you're going to know where you're going from one tissue to another. Or if you get a chance, you'll get to use electron microscope. That won't happen at this school at all. So as I said earlier, epithelial tissue is a sheet of cells that covers or lines bodies, surfaces, or cavities. That is their two main forms, to either cover or line something, or they're going to be in the form of glandular epithelial that we're not going to do at all this particular semester. And the main functions, as you can see there, are to protect, absorb, filter, excrete, secrete, and they're also for sensory receptions. So there's a lot of things that they do, and I would suggest you kind of learn what each one does, because there's going to be three things that are going to be important for the epithelial cells and all the cells. You're going to have to know what they look like. The good thing about this semester is you don't have to look through a microscope, you just have to look at a picture from a textbook. So epithelial tissue has two names. The first name is going to indicate how many cells are in its layer. If it only has one cell thick, it is called simple. If it has two or more layers, it is called stratified. And we'll go through each of them. And then the second name is going to be what the shape of the cells are. Sometimes they're the shape of a cube, which is called a cuboidal type of cell. Sometimes they're in the shape of a column, which means they're going to be columnar cells. And sometimes they're neither one of those, and they're the other shape, which is called squamous, which kind of looks like a flattened scale-like type of thing. So we'll go through all of them as we go through it. So here's a picture of what we're talking about. If it's simple, it's only got one cell thick. That is it, one cell. So obviously that's not going to be really good for wear and tear, but if you have multiple layers, 1, 2, 3, 4, 5 layers thick in this, it's called stratified. Just by definition, it is greater than 1. And stratified squamous epithelium is going to be the place where you are going to have wear and tear on your body. For example, your skin is made of stratified squamous epithelium. Because if you wear a little bit of it off, it's going to grow from the bottom towards the surface. So here's what they're talking about. Cuboidal looks like a cube. Column looks like a column. Squamous doesn't look like the other two. It looks kind of scale-like, looking like cell. So the best way that I can teach this format is to go to this particular textbook. Actually has pictures of what it would look like. So this one here is a simple squamous epithelium. And personally, I would try and learn it by looking at the pictures and making sure that you know three things. One, what a description of it is. So the description of this is it is a single layer of flattened cells, and that's basically its main definition or description. The other thing would be, what is its function? Because this is only one cell thick, you can have something pass from this side to the other side. So the function of simple squamous epithelium is diffusion and filtration. And it's going to be in a lot of sites where protection is not important. Obviously, having this type of tissue inside of your lungs, you're really not going to be having too much wear and tear on the inside of your lungs. This type of cell also secretes something that's super slippery, and it's called a serosa. So as it says here, it secretes a lubricating substance called serosa. So this particular one here, which is an alveoli, which is an air sac of your lung, is going to allow oxygen, which might be here, to pass over or diffuse across the membrane, and then you would have it in your capillaries. So where are the places that you would find simple squamous epithelium? Obviously, there'd be places where you don't need a lot of, or meet a lot of wear and tear. It is going to be found in the kidney glomeruli, the air sacs of your lungs, which is called the alveoli. It's going to line your heart and blood vessels and lymphatic vessels, and it's also going to line the ventral body cavity, in which case it's called serosa. When we give you the test, which will be in 2 weeks, you just need to name one place. Those are just 4 or 5 places where it would be found. And you'll see as you go through this semester in A&P2 that a lot of things are going to have their outside lining made of simple squamous epithelium. One of the things that I talked about when I did the Zoom meeting the other day was, if you think of an organ and having it covered with saran wrap, that saran wrap would essentially be a simple squamous epithelium. If you take that saran wrap and flip it over so that you're covering the inside lining of wherever that organ would live. For example, the heart lives in a sac called the pericardial cavity, and the lung lives in the rib cage. So as you take and flip that saran wrap over from one to the other, you want to make sure that it doesn't stick together, particularly in the body. So the serosa that's going to be secreted by these tissues here are going to make sure, like the lung here, that as it goes into the rib cage and your lung expands because you took a breath in, it doesn't stick to the inside portion of your rib cage. That disease, if that happens, is called pleurisy. So there's lots of diseases for a problem that means it's not working normal. So the 3 things you need to know what it looks like. That is the description here. You need to know what its function is. Its function is going to be filtration and diffusion. And the places that you're going to find it, I would keep my life real simple and just kind of remember air sacs of the lungs or alveoli, lining ventral body cavities. You can put down kidney glomeruli, but a lot of times if you just put down kidney, I'm going to mark it wrong, because specifically the kidney glomeruli are made of simple squamous epithelium, and the next one I go to is going to be found in the kidney, and it's going to be the kidney tubules, and it is going to be made of simple cuboidal. So the simple cuboidal is just like this picture here. These are all kind of cubed, and they're all lined up next to each other. They are only 1 cell thick, as you can see here, just 1 cell thick, and its function is going to be for absorption and secretion. I'll show you what I think. If you go over here, this one to me looks like a perfect cube. This one does too. Some of these others, because remember, these are going to be like threads of spaghetti that are not going to be straight up and down. The center thing here is called the lumen. that means something is going to go through it. In this particular case, since it is in the kidney tubules, they are going to be in a, specifically it'll be in the medulla of your kidney. That's AMP2, you don't have to worry about that, but I would just remember it's going to be the kidney tubules, or it's going to be in small glands, or also an ovary surface. So this particular one, as you're looking at it, truly does look like a cube, as you can see the pictures here, but it is going to have a different function, even though it may be in the same organ. So the kidney has kidney glomeruli in it, and it also has kidney tubules, so one organ can have many different types of tissues. The next one is going to not look like a cube and not look like the first one, and it's called simple columnar or columnar. They look like these little stacks, little soldiers all standing next to each other, as you can see here. So they look true to me like piano keys. Here would be the black one, which is the nuclei, and here is the piano keys. Once again, this white here is the lumen. So the way that I would remember where I would find it is very, very simple. It would be in the digestive tract. So the digestive tract for the tissue in the lumen is going to start at the stomach, right after the esophagus. We'll talk about what that's made of shortly. Through the stomach, which would go into the small intestines, which would then go into the large intestine, and then pretty much it's all going to be lined with simple columnar epithelium. The function of simple columnar epithelium is for absorption, and it's also for secretion of mucus. These big circles here are called goblet cells. Goblet cells are going to secrete mucus so that as food has been broken down in your stomach, the food particulate matter goes through here, and it's going to be absorbed through this one cell thick layer of simple columnar epithelium. And so that it doesn't stick to the sidewall, these goblet cells are going to secrete mucus, and that's really what is going to happen to your food. As it gets broken down and as it goes through the small intestines, you want to absorb all the nutrients, and if it sticks, it's not going to be absorbed. Or if these areas are not there, it's a disease where you're not absorbing things as well as you would like. So the function of it is basically for absorption. That's why I always try and get you to remember that it's going to be the digestive tract, even if you don't know that the digestive tract is going to consist of the stomach, small intestines, large intestines, rectum. All of them are going to be lined with simple columnar epithelium, but the esophagus is not. And I'll explain that when we finally get to stratified squamous epithelium. So the places that you would find it, and you don't need to know all of it, is going to be the gallbladder, the digestive tract from the stomach to the rectum. Some other glands, some are going to be ciliated. But at this particular time of learning anatomy and physiology, if you're trying to memorize everything, that's great if you get on Jeopardy. But for the quiz coming up next week, just kind of know where you would find it. So absorption. Mostly it's absorption of nutrients, secretion of mucus so that everything will get moved through there. And that's pretty much it. Some of them are actually ciliated, which has little fuzz on the top. And so that is going to allow you to move things through ciliary action. We'll talk about another one of them, but so far we have, going backwards, simple squamous epithelium, and it's going to be having a function of diffusion and filtration. Simple cuboidal epithelium, it's going to have a function of absorption and also secretion of mucus. And then simple columnar epithelium, which is going to be absorption and secretion of mucus also. So in this particular case, all of these epithelial tissues are going to be found in different places. The next one is a little bit different. This one here, they're showing you the trachea. The trachea is going to be your tube going from your mouth down into your lungs. And so this one has the same thing. It is only one cell thick. So if you look at each one of these, this cell goes from the top all the way down to the basement membrane, which is the purple thing. This one only goes up halfway. This one goes up maybe a third of the way. So when the early anatomists were seeing this, they described it as falsely layered because they didn't have good microscopes. So it was later that they found out, or they described it as stratified. We now know it's falsely stratified, meaning that each one of these cells touches the basement membrane, but not each one of these cells reaches the surface. So if you look at this one, it goes about halfway. This one goes all the way up. The big things here are giant goblet cells. The goblet cells are going to contain a lot of mucus, and their purpose is to make sure that something is not going down the wrong pipe, as my mother used to say. So when you get to AMP2, you'll find out that there's an organ in here called the epiglottis, and it's going to be moving things, either air going down to your lungs, or there would be a tube behind here called the esophagus, and the epiglottis is going to be responsible for making sure that something goes down the right pipe. For the most part, food is going to go down the esophagus into your stomach, and air is going to go down the trachea into your lungs, for the most part. So this one here is unique because it is only one cell thick, but it does have this unique layer. It doesn't have simple or stratified. It has falsely stratified, meaning the layers are false in their appearance. They're all going to be sort of columns. And so they are going to secrete substances, particularly mucus, and they have a propulsion of mucus by ciliary action. This is all AMP2, but this cilia, which kind of looks like fuzz on the inside of your throat, is designed that if anything other than pure air touches it, it's going to have each of these cilia would go to a nervous system, and you all probably have had something go down the wrong pipe. If you have like one drop of water that goes down your trachea rather than your esophagus, you're going to cough horrifically. If you have a little crumb from a piece of toast and it goes down the wrong pipe, you're going to cough a lot, okay? The coughing mechanism is designed to try and move it from going into your lungs and cough it back up. You know, if it's a little speck of crumb of toast, you can't cough it back up, or a drop of water, you can't cough it back up, but you are going to be coughing, and you can come look at me like that's acting. I did not choke on anything, but if I had, I would have been working out my abs. So I usually tell my wife that that's my ab workout when I cough like excessively. That is a way that your body can be responsible for making sure that something does not go down the wrong pipe. So pseudostratified columnar epithelium is kind of interesting. We'll be covering that a lot more in AMP2 because there's a lot of people, maybe that you know, that smoke. Smoking will destroy the cilia. So most long-time chronic smokers will probably have a dry hacking cough because your body is going to try and not have things go into your lungs. Anyway, for what we're doing right now in histology, this is what it looks like. It does have, this one is actually ciliated and it's falsely layered, as you can see here, but you can kind of see one here, one's going all the way down. It is falsely layered columnar epithelium, and you would find it in the trachea, the upper respiratory tract. There are also some weird places that no one studies unless you're going to be a histologist. The male sperm carrying ducts and some other large glands are going to be made of pseudostratified columnar epithelium. And so there are different places in your body that are going to have different histological preparation. Anyway, the last one of the epithelial tissue that we're going to cover in this particular semester is stratified squamous epithelium. So even though pseudostratified had stratified in its name, it was only one layer thick. This one here is called stratified, meaning more than one layer thick. And as you look at this little cartoon picture, here's layer, 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 layer. And you can see it here, over here. Layer, multiple layers. So what that means is its purpose is to protect the underlying tissues that are subjected to abrasion. So some of the places that you would find it is going to be in your esophagus and your oral cavity. Your Oral cavity goes from here to here and then down. And if you remember the last one that I showed you with simple columnar epithelium, it is going to be stratified squamous all the way down until you get to the stomach. At the stomach, it's going to switch to simple columnar epithelium for absorption. So some of the other places that you would find stratified squamous epithelium is going to be, if it's keratinized, it's going to form the epidermis of your skin, which is basically a dry membrane. The other places that you would find it, obviously, is the oral cavity and the esophagus. The mouth is the oral cavity. Also the vagina. So what can happen with this is if you, and I'm going to use my example of pizza. Everybody has probably burnt their mouth on hot pizza. So it sticks to the roof of your mouth and you kind of burn your skin. If you burn your skin enough that you get a blister, you have a 2nd degree burn. But if the pizza was out here and you burnt it, you have destroyed this top layer of skin in your mouth. And I'm sure all of us have done that before. When you destroy it, it's going to still protect the underlying tissues, but you burned off the top layer. Does that mean you're going to stop eating pizza because you burned it? Probably not. The only thing that I can ever think of that I stopped eating because it burned my mouth was Hot Pockets. When they first came out, they didn't mention that it was boiling water inside of that little pocket, and I bit into it and burnt my mouth and had 2nd degree burns. Honestly, I've never eaten a Hot Pocket. I have burnt my mouth with pizza, and I am not going to give up pizza because of that. So, think about that. You've probably lost some skin as a kid and it came off of your knee. You might have a scar, but you were going to still keep playing. And so the way that the tissue is going to heal is through a process of regeneration called mitosis. So where these cells are on the top and it gets burned off or abrased off, the cells at the bottom are going to shuffle their way towards the surface and they will heal that way. One of the interesting things about stratified squamous epithelium, and we'll talk about that when we get into chapter 5, is it works really good. It is going to be able to protect you from all sorts of stuff, but there's still things that can penetrate through it. If you have ever brushed up against poison ivy, you probably have gotten poison ivy. That means the oleoresins that would be on your skin have worked its way through and it's penetrated through the stratified layers, and you are going to have some sort of itching and bubbling type of thing. If I'm just going to talk about the oral cavity, which is interesting because we used the pizza example. If you put something hot in your mouth, it is good to have the inside of your mouth made of stratified squamous epithelium. You also put things in your mouth that are acidic. So if you want to think hot things as coffee, tea, soup, even pizza, that lining of your mouth is going to protect it. If you've put things that are acidic in your mouth, such as orange juice, tomato juice, or anything else, your inside lining of your mouth, the lumen of your mouth, is going to be, it might be damaged slightly, but it's going to get better and heal. Chances are you probably have put sharp things in your mouth. And so one semester I asked, did anyone ever in this class eat a light bulb? And some kid did actually say he likes Christmas light bulbs. You can't even make that up. But so you probably have put sharp things in your mouth like Doritos or corn chips. And if it turns sideways, you are chewing up the inside of your mouth. Unless you are eating light bulbs, in which case you have a problem. Anyway, so that's stratified squamous epithelium, and you'll kind of notice that it does look like, I'm going to go back to simple squamous. Simple squamous is right here. It does look like this, and then if we put that and stacked it on top of that, that is really, we go from simple, which is one layer, which isn't going to be much protection, to multiple layers, which is this here, which is going to protect it from sharp things, acidic things, and hot things. So this particular book and your lab book also mentions stratified cuboidal and stratified columnar. Cross it off. We are not doing it. If you become a histologist, you would have to know that. As a matter of fact, the bottom of this particular textbook says, see the atlas for the pictures of these that are extremely rare. At the beginning of anatomy and physiology, you don't even have to even put it down. You would have to put stratified squamous epithelium because that's the only stratified one that we use. The last one here of the epithelial tissue is one that is not going to have a first name or a last name. It is called transitional epithelium. And it makes a transition from the base here to something out here. So if you look at the cells here, they do look a little bit different than the cells out here. The way that I always remember transitional epithelium and where you would find it is going to be in the urinary bladder, the ureter, or the urethra. So if you want to think about this, this is the urinary bladder right here. The tube that goes from the kidney to the bladder is called the ureter. The tube that comes from the bladder outside of the body is called the urethra. So an easy way to remember it is all the terms that begin with U, excluding uterus. A uterus is not made of transitional epithelium, but urinary bladder is, a urethra is, and also a ureter. So the function of it is to stretch readily, to permit stored urine to distend. I kind of always thought of, okay, you're creating urine and it's going to get here and, eventually it's going to get bigger and bigger and bigger. When your bladder gets to a certain point, you got to go. You have to urinate. And so it will allow a lot of stretching, and then hopefully you'll be able to urinate eventually. The way that I always thought of the urethra is it is exactly like this, but it is going to be like a fire hose. If you've ever seen a fire hose that the firemen use, it can be rolled up and all of the water can be knocked out of it, but eventually once they hook it up to the hydrant, it gets really big and it is going to distend. So I've often thought of, sadly, as the urine here is coming out of the urethra, it is to me a lot like a fire hose. And so it's silly things like this that have allowed me to remember all of these things. The description, it's going to look like this. As it says here, it resembles both stratified squamous and stratified cuboidal, but it is not. The basal cells are cuboidal or columnar, and the surface cells look dome-shaped. If I use my fire hose example, and as you're building up urine in your bladder, these to me on the outside perimeter look like they're stretched. And that's because you have to urinate. So just a simple way of trying to remember it, but don't put down that they are going to be transitional epithelium. Your lab book says that a certain portion of the kidney is transitional. That's where it's going to be in the hilum here as it goes into the ureter. I would make my life a little bit more simpler and just remember urinary bladder, urethra, and ureter, and just because we're going to ask you that in 2 weeks when you have the test. So that is the end of epithelial tissue. The other place you would find epithelial tissue that we don't cover in the lab is going to be glandular tissue, and I am then now going to switch over to the connective tissue. So we're just going to go from one slide to the other. And connective tissue is the most abundant and widely distributed of the primary tissues. Remember, the three primary are going to be connective tissue, epithelial tissue, muscle tissue, and also nervous tissue. We'll get to all of them. Its main function is to bind and support, protect, insulate, store, reserve food, fuel, and transport substances as blood. There are four main categories of connective tissue. They are connective tissue proper, that I'll talk about today. They are going to be cartilage, that we'll do next week, and bone and blood. And actually, we don't even cover blood for the most part in A&P1. We do that as the beginning of A&P2. So connective tissue proper has a bunch of categories, and I'm just going to go to the pictures so that you can see them. The interesting thing about all connective tissue is it has three main elements. One of them is going to be a ground substance, another is fibers, and the other is cells. So when you think of the cells that are going to be making up connective tissue, some of them are going to be different, and they have a picture of what they would look like here. And so the cells are in this particular cell types. Macrophages are all going to be white blood cells. There's some mast cells, some fat cells that are going to be in this, okay? The background stuff is called the matrix. The matrix is going to be, or the ground substance is going to be the unstructured gel-like material that fills the space between the cells. You have a whole bunch of cells, but there's going to be space in between them. Most of the time, it's going to be interstitial fluid. As you go through this here, some of the other components are going to be chondroitin sulfate and hyaluronic acid. They are the proteoglycans that make up this background material. Most of the time, it's water. And when I teach the lecture portion of this, which I am not, basically, if you stretch something beyond its elastic limit, why does your ankle swell up? Well, it's because you're releasing all of the water that was trapped within this connective tissue. The other thing that is going to hold it together is going to be the fibers. There are 3 types of fibers. One of them is collagen, which is going to be tough and give it a lot of tensile strength. The other is going to be elastic fibers that will allow it to stretch a little bit, but not too much. And then reticular fibers are kind of like a branching network, like a hair net holding your hair together. So I'm just going to go to the different types. And so areolar connective tissue looks exactly like this. This looks like some kid scribbled all over the place. As a matter of fact, if you had to look at the microscope, I describe it as a puddle that in the puddle has horsehairs, which would be the fibers, and some of the background or some of the substance. So if you want to think of cement, which is a good analogy, in order to make cement, you're going to have certain things like lime and also cement and rocks, perhaps, if you want to think of these as the rocks and all of this other stuff as the stuff that makes cement. If you want to think about it, there are certain barns around here from the 1700s that the walls are still intact, and that's 300 years ago. And the reason for that, if you look at some of these fibers, the fibers, where did they get the fibers from? Well, most of the Moravian people around here had horses, and they would put horsehair into the background of the cement. And believe it or not, some of their mortar is still holding up for 300 years. So if you think about that, you can relate any of the histology that we're covering and put it into something that you may deal with on a day-to-day basis. So areolar connective tissue looks like this. I can't even describe it, although if I was at a blackboard or a whiteboard, I would just take a couple markers and scribble all over it, because that's usually what it does. Its function is to cushion organs. The macrophages, which are the cells in here, are going to phagocytize, which means eat bacteria. So if you have something like you've cut your hand and you're bleeding, there are more than likely germs on your hand. As the germs now leave your hand and go into the tissues of your body, it is the areolar connective tissue and the cells in there that are going to start the process of killing off the bacteria. So because of that, they play an important role in inflammation, and they're going to hold together tissue fluid. And I'll use that as an example a little bit later. So some of the places that you're going to find them is underneath all of your epithelial tissue. So your skin is your largest organ in your body. Underneath your skin, if you could pull it off, and we'll talk about this when we get to chapter 5, underneath it is going to be this areolar connective tissue, which is going to be holding your skin in place. It is also going to surround capillaries. You have thousands of miles of capillaries in your body. And around every one of those capillaries are going to be this tissue, which is called areolar. It's going to package organs. You know you have lots of organs in your body, and this is this packaging material that is going to be holding it in place. One semester, a student said it reminded them of looking at cotton candy. And it really does. So I'm going to just stick with a building analogy. It reminds me of pulling apart insulation in a wall. It does really look like the insulation that would be in the pink insulation. So however you remember it, this is what it looks like. And this is where you would find it. It forms the lamina propria underneath the epithelial, lamina propria underneath there. So you got miles of this in your body. Second one is fat. or adipose connective tissue. I think this one, and this one here is a silver nitrate stain, it looks to me like soap bubbles. Another analogy of this is if you've ever popped bubbles that were in packaging material, that's what it looks like under a slide. Most of the slides or the tissues that we're going to have aren't going to be making them look like black outlines. They're probably going to be a color of pink. So what does fat do, or adipose connective tissue? It provides a reserve food fuel. It insulates against heat loss. It supports and protects organs. So I'll just go through a few of them. Most of us don't have to worry about a reserve food fuel, but as we're heading towards the colder months, there's a few squirrels that run around in my yard. A lot of times, just before winter happens, the squirrel looks like he's eating all over the place. And of course he is, because he's building up fat stores that he can live off of all of the winter. Most of the time, the squirrels are not going to go to Wegmans or another grocery store like we can, so they got to store up for the winter and live off of the fat. It's also going to insulate against heat loss. There's two populations of people that I know don't have good fat tissues. It is older people. They start to lose their adipose tissue and they are cold all the time. And also bodybuilders. Bodybuilders try to shrink the fat on the subcutaneous fat so that they can bring out the striations in their muscles. And they're probably cold all the time. But elderly people, if you have an elderly relative or something like that, probably if it's just cool to you, they're wearing a sweater or a sweatshirt or a shawl if they're doing something along those lines. The places that you would find fat or adipose is going to be the breast tissue. The majority of breast tissue is made of adipose connective tissue. It is going to be under your subcutaneous tissue. That is going to be your skin. So if you look at your skin, there is going to be on the outside stratified squamous epithelium, and then it's going to be deeper. The subcutaneous tissue is going to be made of adipose. It is around your kidneys. So your kidneys don't have a whole lot of bony protection. Usually it's just the 11th or 12th floating rib, but you're going to have a lot of fat around the kidneys. You also have fat around your heart, depending on your diet. Where it says should have the word around, your eyeballs are not made of fat. They are made of eyeball stuff, and we'll dissect the eyeball later in the semester. But behind your eyeball is where you would find the fat. As a matter of fact, if you've ever seen pictures of the prisoners from Auschwitz, the last fat pad that goes away is the fat pad behind your eyeball. And once your eyeball starts to sink in your head, you're probably not going to recover. So that's basically what adipose connective tissue is. The majority of the cell is, here is the nucleus. The whole white thing of this particular cell and all of these is adipose or fat, adipocytes or fat cells. So they work really well in the sense that they are going to protect, they're going to insulate against heat loss. And so this particular type of connective tissue is easily recognizable. I honestly think it looks like, in this particular case, a black soap bubble, or a lot of times it's a pink soap bubble. But if you want to think of them as the bubble wrap that you would use in packaging, it really does look exactly like that. The next type is reticular connective tissue. And this is kind of what it looks like, although sometimes it may be a little less purple and more tan. And so the easiest way to remember this one, it is going to be mostly found in lymphoid tissues or lymphoid organs. So the lymphoid organs that most of you have probably heard of are called lymph nodes. Lymph nodes are going to be all over your body, and so the way lymph works is as you have fluid from your heart going through the lymph, it's going to return it back to your heart. And so if you have ever had a rip-roaring sore throat and had a streptococcal infection and felt along the side of your neck, those bumps that you have felt there are a lymph node. What the lymph node does is its job is to make sure that the material that it sends back to your heart has been purified or filtered. And so they will keep getting bigger and bigger and bigger because that's what their job is to make sure that they're filtering. So as fluid goes through this stuff here, all of these cells here are filtering it out. Same thing if you have rocks and you pour water through it and you have sand after that, that is a good filtering system. In the case of lymph nodes, it basically is going to filter the lymph going through it and as it goes back to your heart. Same thing with the spleen. The spleen is actually in A&P2, we'll talk about it as the graveyard of dead red blood cells. So as blood goes through there and gets filtered, it is going to return back to the heart, the lymph tissue, so that it's been filtered. So lymph nodes are the big ones, or lymphoid organs, which would include the spleen. The bone marrow is going to be important with this here, but it does look exactly like that. I personally think, because I'm a very visual learner, I would take a clump of grapes or a cluster of grapes and hold them up to my eye until it was blurry. That is what that particular tissue looks like. And so the inside stroma, or the inside portion of that, is going to have white blood cells and macrophages and mast cells. They're all going to be responsible for filtering the lymph going through it in the case of lymph nodes, and that's kind of what they look like. So the reticular tissue looks like this one. Adipose tissue looks like this one. Reviewing and going backwards, this one looks unique. It just looks like scribbling. And like I said, someone once said it looked like cotton candy, and I guess it really does. And it also looks like insulation. This one here is the bubbles that you want to pop from packaging material. And this one here is grapes that you're holding up to your face so that they're blurry. So those are the connective tissue, loose connective tissue. There is a group of connective tissue that is dense, and we're going to do two of them. So dense regular connective tissue is unique in the sense that it has a great tensile strength, can withstand a great amount of stretching, but it can only sustain that stretching in one direction. And it appears slightly wavy so that there's a little bit of a stretch. And it's very poorly vascularized. For anyone who has ever sprained their ankle, it does not heal real well. So two of the places that you would find it, it would be in a tendon or a ligament. The difference between a tendon and a ligament is what they attach to. And so in this particular case, a tendon attaches a muscle to a bone. It could be anywhere in the body. So the calf muscle would attach to the Achilles tendon, which would go to your calcaneus. So the tendons are going to look like this. When I usually draw it, I draw it like a Pringle potato chip, because you would have the ability to stretch it a little bit, but if you stretch it too far, you're destroying it. So a tendon, everyone kind of knows of that. A ligament is going to connect two bones together. That is the definition's difference. Tendon attaches a muscle to a bone, whereas a ligament attaches two bones together. And an aponeurosis is not something anyone has probably ever heard of, but it is where a broad muscle, in the case of a latissimus dorsi, would attach to all of the thoracic spinal column. So because these are all going in the same direction, they can withstand a tensile strength going in one direction. So a muscle, like the bicep muscle here, would be really good going in one direction as it attaches to actually that's going to attach to the coronoid process. But like something that has a certain amount of stretch, you can only stretch it so far. If you stretch it beyond its elastic limit, you damage it. In the case of a muscle or a tendon, it is called a tissue deformity, and it is called a sprain. So if you sprain a muscle or sprain a tendon, you have stretched it beyond its elastic limit. Like these things here, you can stretch it a little bit, but if you go too far, so if we started here and it goes to here, and we stretched it to here, you have done something called a plastic deformity, and that would be a sprain, or in the case of a muscle, it would be a strain. So a tendon can be sprained or strained. A ligament can be sprained because it's not going to have too much stretch, but it has a little bit. And of course, like if you've ever sprained your ankle, you brought it to its elastic limit, and then if you go beyond it, it's going to break or snap or be destroyed. And so there is first, second, third degree, and sometimes you can actually rip the tendon right off of the bone. So whether it is a ligament or it is a tendon, it is going to have a stretch in one direction, not in multiple directions. In the body, there's something called dense irregular connective tissue because not everything stretches in one direction. So it can withstand tension exerted in many directions. It provides really good structural strength. So as you look at this particular picture here, it makes up your fibrous joint capsule. This is of the shoulder, and you can probably stretch your arm one way or the other way, or up or down or something like that. But if you go too far, you're going to rip this thing similar that you would do to a tendon or a ligament. The other place you would find it is in the dermis of the skin. And usually in class, I demonstrate on myself. So basically, I'm going to put my hand down right here. So I'm sure you can see my hand, and you'll kind of notice if I push my skin that way, it sometimes snaps back, and if I push it this way, it snaps back. But if I pinch my skin together like this is just old skin, you'll notice it doesn't snap back. You have to work its way. So when you get old, you'll have to deal with that too. You can do that at home and see whether or not your dense irregular connective tissue is as bad as mine. But the purpose of it is so that it can pull in different directions. I always like demonstrating in class with that one. The last one that we're not doing is elastic connective tissue. Elastic connective tissue is going to be found in large vessels coming out of the heart, like the aorta. And as the heart contracts, it's going to give a push, and it's going to give a stretch, and the stretch's recoil will allow you to move blood through the body. But I don't even do it in A&P1 because we're going to have something next week when we get to it called elastic cartilage, and I don't want you to be confused with that. And cartilage is the next one that we'll do next week, and that is it.